Community Health Department of the Christian Institute of Health Sciences and Research in Dimapur, Nagaland, conducts outreach health services among the disadvantaged and marginalized communities in Nagaland. While most medical specialties revolve around the identification and treatment of disease, community health focuses more on the preventive and promotive aspect of health and the early detection of prevalent diseases and its complications. We do have a curative component as it is essential in building relationships with the communities. Dansripa block is a vast plain area with 23 recognized villages. Major settlements consist of some Naga tribes, Dimasa Kachari, Nepali and migrant workers from Assam. Most of the population are engaged in agriculture and small business. Activities of the department are conducted in Dansripa block of Dimapur district in partnership with the Department of Health and Family Welfare, Government of Nagaland through terms of reference since 2011 and also in Metsipema block of the same district from 2017 under a public-private partnership mode. An initial baseline household survey and participatory rural appraisal conducted in 2012 provided baseline data and general information about the area. Priority of the department's work is strengthening the primary healthcare programs in Dansripa block with particular focus on maternal and child health services. The community health department team travels to the area and conduct weekly mobile clinics in all the 7 sub-centers, 1 primary health center and 1 community health center in the block. The patient is first registered by the health center government staff. The height, weight, blood pressure and other vital parameters are measured for adults. Weight for age, weight for height calculated and plotted on a growth chart for children under 5 years of age. A community or family physician sees patients with common and chronic diseases and children are screened prior to routine immunization. The pregnant mothers are also seen by the MSc community health nurse.
Here at our MCH clinic, basically for the antenatal mothers, we do registration, history collection, and we do a physical assessment for them, along with a deeper abdominal examination. And then for those women coming for the first time, we do some basic blood investigation for them too, which includes hemoglobin, blood grouping, HIV test, hepatitis B and hepatitis C testing. Along with this, they are provided with appropriate medication and all which they require and adequate counseling based on the complaints as well as on the trimester that they are in. MCH clinic time the block saule pari de aru itu lo de abhan time dia abhan tera abhan ge age te abhan kiniga oshi age kimanta bachcha se na.
Innovative methods are used to provide health education to a group or even individually to patients that require special attention. As the availability of medicines is irregular in the field, low-cost generic medicines are carried by the team and are dispensed at subsidized rates which patients can afford to pay for. In addition, village health and nutrition days are also conducted covering all villages in the block. Through the community health department's efforts, both the local communities and the migrant communities have benefited from the services of the department. In this way, the time, distance, and cost of traveling to the major towns to seek expensive medical treatment have been minimized. In addition to services rendered at the clinics, the team also conducts home visits along with the Asha of that village to see patients who are chronically ill or afflicted with debilitating disease and have failed to follow up at the clinic. Such patients are given necessary treatment and referred to higher centers if needed for further investigation, treatment or rehabilitation.
We happened to meet her some 2 months back. Then we found her that she was chained. And actually on assessment we found that she had some psychiatric problem and that she had been suffering for many years. She was not on medication. So we consulted the doctors out there in CIHSR as well as in Vellore, CMC, and then we started her on antipsychotic drugs. On taking the medications, her condition improved. So now she has been able to carry out all her activities of daily living, such as cooking, taking care of herself, bathing, as well as she is able to communicate even with others properly.
The project inputs also include building the skills and capacities of the health personnel, such as the auxiliary nurse midwifery, the accredited social health activist, and the Anganwadi workers through periodic training programs. With this, the village health committees and health center committees have also been trained on management of their respective villages and health centers.
Along with our other activities, we also conduct training for the ASHAs as well as the ANMs at the sub-center. We also conduct training at the Community Health Center at Thansari Par as well as delivery point at Pimla. This training is focused in order to build the capacity of the government staff who are working in these areas. We focus on antenatal care, intranatal care as well as postnatal care. These trainings are basically targeted in order to improve the skill of the personnel working out here. We do mock drills for them as well as have pre-tests and post-tests in order to assess their ability or the effectiveness of the training programs.
We do Thansari Par CIHSR laga staff ase. Aro itia amikan referral staff, community staff khan bra amikan la hospital de aigina ase. Aro takhan every month amikan laga hospital de aigina mutu kure. Aro staff khan nimide bi takhan kitia ahibo patient sa piche de amikan ke training de.
Meetings with the Department of Health and Family Welfare takes place at regular intervals with presentation of data and project activities to the Chief Medical Officer, Deputy Chief Medical Officer, Senior Medical Officer and various staff from all the health centers in Dimapur district and representatives from various vertical programs.
Research forms an integral part in the activities of the Community Health Department. There is a paucity of quality data to accurately reflect upon the situation in Nagaland, or for that matter, the northeast region of India. So for the same, we conduct scientifically sound, ethical, community-based researches to identify important health problems as well as to plan and implement programs for the same. So we want to take research and translate it into community impact. One such research initiative is the oral cancer screening program being conducted in collaboration with Biocon Foundation, Bangalore. We've conducted the program in randomly selected clusters in a rural block and in an urban area, including 19 schools and colleges, screening nearly 10,000 people in the last 1 year. The main objective of the study is to study the patterns of tobacco use and the prevalence of precancerous lesions and its determinants. Volunteers from the community are trained to use the mobile phone installed with a special app which captures data including pictures of suspicious lesions. The data is assessed remotely by a specialist doctor who identifies precancerous lesions and recommends accordingly through the app. The captured images are also used to educate the screened participants about the risks of using tobacco products. One of the main challenges in providing quality healthcare in Nagaland and adjoining parts of northeast India is the poor condition of roadways and a skeletal public transport network over difficult terrain. We hope that with our ongoing research initiatives, the marginalized communities in Nagaland will have improved access to quality healthcare.
Let's go!
Community Health Department also celebrates important health days such as the World Health Day, World TB Day, No Tobacco Day, Hepatitis Day, Diabetes Day, and others, mainly to raise awareness and advocate issues of public health importance to communities. On such days, health education, free screening, and medical examinations are done for the public. We try to use novel, innovative methods to help spread health messages to the public. Much of the works conducted by the Community Health Department has been made possible through the collaborative efforts made with various partners and stakeholders. The plans which the department intends to carry out in the future include prevention of non-communicable disease in Metsipema block of Dimapur district, implementation of the church-based health program with the Nagaland Baptist Church Council. One of our institute's objective is to develop a vibrant community that cares and supports each other, thereby reflecting the nature and character of Christ to the society around.
Baca tu bisi damur nama tu pai dena operation golo thaki hoide nokuri kena ini normal bra paise aro baca tu bisi tu pai kena ICU room te 16 days nisna thaki kena bill bi bisi ulai kena tan bra bisi ma adha to ma kursia thai terai kena ta to value kena ahise
ये बच्चा तो करते पाबले बेसी कोशिश करी से हम लगा खून भी बेसी जाय से बीपीएल भी बेसी ताकी से पहले भी तते बच्चा ना पा हो से चारमाल लगा डॉक्टर खान क्या ताई भी हुनी से हुनी के नाम के नीचे ताई गाड़ी पर उठा के ना लय से अरे लय कि ना ताई खान तो इमरजेंसी ऑपरेशन करी लय से और बच्चा के भी बचाई से और आमी के भी बचाई से तो बच्चा
मुद्दू खाना एक महीना निचना बीमार हो से थेन हाथ भी हिलियो ना पड़े बात भी खाओ ना पड़े इना एक महीना गोड़े थाकी से ताई बीमार होने रेफरल ते दो जाते ताई के साथ ताई पुलिस जा टीबी हो से अलवी ताले जाने एक दिन बाद हो से ठीक बराबर हो से और इतने पीछे दिन दे ताई मुरीबो निचना हो से मुरिया निचना हो से आईसीयू रूम ते जाने एक हफ्ता निचना हो से और ताई ताला बीमार खान भी बाल हो से ताई तो असल तो मुद्दू खा बीमार आसे अरे ताई तो इधर तो सिस्टर नर्स खान तो ठीक परा ताई के साने ताई बाल होने ते कोर पुंची से इधर आराम परा बुझा से
हमने लाना jar ase pimla laga asa tai laga naam Elina pimla bosti laga ek rati tai laga pet dikhai she moi ki mati she jai she phujurte matha bi gurikina chakar ho jai she to phujurte auto matikina 1000 bra higher gurikina referral hospital tak anishe
referral hospital punjab shete emergency ultrasound kurise aro ultrasound kurab shete ta khan pra koise but tube te bacha se kusharu itutu burst ho je shikse aro tate pra emergency operation kurubo koise tate pra operation kurikena bal ho je she ta khan pra ami ke bachaise aro ite tak ami bal ase.
With this objective, the Community Health Department strives to work among the poor, disadvantaged, vulnerable and marginalized people so that their lives will be improved through better health and living conditions.